All right, good morning, everyone. I'm joining you here from the Pima County Health Department today. I'm going to talk to you a little bit about One Health clinics and specifically about the One Health clinic that we have been operating for over 2 years now. So just briefly to orient you to what One Health might look like at a local health department, thinking this is all kind of coming from our public health lens. So our One Health program at Pima County, we're in the epidemiology division. And so in this program, we oversee the surveillance and monitoring of our vector-borne and zoonotic diseases, but among lots of other things. We incorporate environmental, particularly through heat season surveillance, but also building programs to look at things like lead surveillance, coccidiomycosis or valley fever. We are actively monitoring emerging pathogens like New World screwworm or high pathogenic avian influenza, as we've heard a little bit about. We also work on academic partnerships like our hantavirus project with our partners, Lee Combrink at U of A. You'll hear from her a little bit later as well, to be able to really kind of incorporate and collaborate outside of what our own capacity is. A large part of what we do is rabies surveillance. We get approximately 500 or so rabies exposure assessments that we do each year. And what I'm going to focus on today is our Healthy Companions One Health Clinic. All right, so there are some different models for care if you're thinking about more of a clinical provider sense across One Health. How can you integrate both human and animal care? So you can have something called like a referral clinic where you just offer referral services. You know, if you're focusing on the veterinary side, maybe you're referring to human services if you're asking things about, you know, social determinants of health or other human health concerns that might be zoonotic in nature. You can have things like side-by-side clinics where you bring together health services for both people and animals all at the same place. And so people can access all of those services, but they're not necessarily integrated. You're getting everyone gathered there in one place at one time, but people are kind of just choosing what is most applicable to them. And then kind of at the top of this model is the officially trademarked One Health clinics. And these One Health clinics were really started by a group out of the University of Washington, Vicki Ramirez and her group. So we have really worked to model our clinics off of that. And what makes a true One Health clinic there is the integration of the human and animal health care. There are different ways that different clinics can do this. For example, at the University of Washington, they do rounds at the end of their clinics where they actually have their primary care human provider talking to the veterinarian about each case that they saw that day, and talking about opportunities for, you know, bringing that person back in or what other support can be given in that case. Here in Pima County with our Healthy Companions Clinic, we integrate care through using navigators, which I know we have several people in the audience who have served as navigators before. And so what our navigators do is they accompany each of our participants through the clinic on the day. They're collecting lots of data, but at the same time, they're evaluating what are some of these cross-sector needs. They're thinking about zoonotic things or shared exposures that people might have, and trying to connect them to the services that might be most applicable. All right, so this is Healthy Companions. So this is Pima County's One Health Clinic. This is our mission statement here. So what we strive to do is to provide integrated care and need-based resources that support human and animal family units through a One Health approach for those in Pima County who are unable to access traditional sources of care. And so we thought really carefully about who is our priority population, who are we trying to serve, and we're really striving to find those people who aren't able to or aren't accessing, you know, other clinics or veterinary resources. So how can we reach those people? So our priority population is primarily the unhoused, the unstably housed, and the very low income population across the county. And why these folks? These These folks have lots of barriers to access traditional sources of care. We have lots of different public health priorities across these populations too, right? Our hard to reach populations, it's hard to do surveillance, detect, and provide resources. So public health related things we think about are sexually transmitted infections and family planning. We have hepatitis C testing. We had vaccines until we lost our vaccine equity program, unfortunately. And we also address environmental concerns like heat-related illness, not only for people, but also for their pets, vector-borne and zoonotic diseases. And also underlying this is trying to address things like social determinants of health, which we try to get through by offering various support services in addition to our more clinical services. So how did we actually coordinate this, or how is it looking at the moment? First, we want to see what already exists that we can bring together to offer services. So at the county level, what are our core county services? We have our health department, we have the Pima Animal Care Center, we have community workforce development, and then we also have our community partners, Friends of PAC, El Rio Health, providing clinical services. So what do we actually offer? I'm not going to go through a whole list of things here for time's sake, but we have human health care, veterinary care, housing services are always offered, referrals to other community services, and when available, when we have community partners joining us, we can offer things like harm reduction, like Narcan, food and clothing, hygiene and menstrual kits, and other support services. So what has this looked like across time? So some numbers for you. So since October of 2023 through our January clinic, we've hosted 27 monthly events, which has included 522 human clients across 716 human visits. So we're starting to see repeat people coming back. They're getting to know us, they know what we have to offer, and they're coming back. And we have had 502 individual veterinary visits. We want to make sure we're reaching our target population, so we can see that the majority of people participating are unhoused or unstably housed, and our participation numbers have started to stabilize across time. People report on benefits and barriers of animal ownership, mostly mental well-being and personal safety as benefits, barriers, things that we might expect like food security and access to health care. And what services are accessed? We want to see people accessing both human and animal services at a high proportion. So we track what they're accessing. And we do see that we do have a great proportion that access both human and animal services at each event. Some notable findings, out of 97 screenings for hepatitis C or sexually transmitted infections, 10 of those have been positive, and we've been able to link to care. We've had people opt for transport for addiction services, and we've been able to provide treatment for heat-related illness in a dog and connect the dog and the dog owner to a pet-friendly cooling center. And that's all I have for you today. We have lots of people to thank who have helped put this on, build this program over time, and everyone who comes out to our events to navigate. Thank you.